Hello everyone and welcome to Care to Heal channel. For today's video we will talk about the importance of patients' mobility at the care of nurses. What is mobility? These are walking, running, and moving from one place to another. In order for the nurses to help and assist patients to mobilized, a stable and comfortable feet are the keys. So, let's talk about the details of these two interesting topics. But before we continue, let me introduce myself. My name is Jordia. I'm a Filipino-American registered nurse, OFW, a traveler, and founder of Travel Doves and Care to Heal channels. This video is brought to you by Care to Heal channel. Please support my channel so that I can continue creating educational videos like this. Kindly like and subscribe below. So, let's continue. Patients, particularly the geriatric population, encounter challenges on their daily living activities. Unfortunately for some, losing their ability to move independently is a gruesome reality. Patients developing pressure injury because of inability to reposition themselves are common. People who are bedbound are high risk of this said injury. Pressure injury develops when chronic pressure in bony prominent surfaces of the body occurs. The skin tissue slowly dies due to decreased blood circulation. It is also known as bed sores. Moving patients out of bed and back to bed are essentials to avoid pressure ulcers. This maneuver can be used and practiced at home or in any clinical settings. At home, healthcare staff can only implement maneuvers with small weight-bearing devices such as gait belt, walker, and crutches. Adapting the single-person assist method in a home setting without equipment is necessary at times. In clinical settings, staff can use powerful and heavy-duty devices. Machines called Hoyer lifts. Remember that in any patient's activity such as dressing and bathing, healthcare assistant must start assisting in the weak side of the patient. There are two types of assistance techniques: the single-person and two-person assist. When doing any of these transfer maneuvers, you must keep your body straight. The back must be aligned to the center and no waist or back twisting. As you move lower, bend your knees. For additional balance, keep your feet apart and wider than your shoulder. Single-person assist techniques. A single-person assist techniques are applicable to people who has partial ability to move. Example, patients who had minor surgery, one leg can pivot, and the upper extremities can assist in moving. Healthcare workers must know a basic step-by-step guide to single-person assist with patient safety in mind as the priority. Prepare the patient by introducing yourself and explaining what you will do. Make sure all clutters were removed to safely transfer the patient. Position yourself to the weak side of the patient to provide support. The strong side of the patient moves first. Place the chair or wheelchair on the healthier side of the patient. Executing a safe two-person assist. For people who are full and complete bedbound, two qualified person assist is a must for safety. Patients who can't move 50% and more requires double strength assistance. The two-person assist can safely move these patients with proper maneuver and coordination. Follow all the steps in the single-person assist above, and then continue with the additional steps below. Plan the safest and appropriate move for the patient. Try to prevent lifting. Use slide, pivot, or shift. Keep your body near to the center of the subject. Use gait belt or available lifting devices. Keep proper coordination and collaboration between the two caregivers. Designate the transfer director, listener, and actor accordingly. Knowledge on how to protect yourself and your patient from injury during the move means healthier and productive career. Many nurses have back issues. The longer and more seasoned nurses they are, the worse back problems. Many nurses are the financial supporter of their families. For these nurses, keeping themselves healthy and pain-free are important. So next time you move a patient, follow these steps. Keep yourself free from herniated and degenerative discs. As I said earlier, the foot care of nurses are needed for them to help and assist the patients. Remember, a nurse cannot help patients if they are sick or something bothering them. But, first let me ask you, what are the vital role of foot care for nurses on the move? You wanted to ask yourself, how's your feet? All of us need a very good habit when it comes to care of our feet. Now, how about the nurses? They work long shift hours, standing and running. Understanding the demanding nature of nursing and foot health correlation is important. Nurses normally works 8 and 12 hours shift. They are always on their foot to render nursing care to their patients. When there is an emergency case, they run. Another concern of nurses are their backs. Many nurses got back problems because of moving patients out of bed, giving bed bath, and cleaning patients. Back pain radiates to bilateral legs. A common medical condition is known as sciatica. There are high statistical evidence on work-induced foot problems among healthcare workers. Bursitis and fasciitis are common foot problems. Bursitis is a type of inflammation in joints such as ankle and knees. Fasciitis is the inflammation of fascia or tissues under the skin surrounding nerves and muscles like sole of foot. I personally experienced foot fasciitis. It took me 3 months to relieve the pain and heal completely. I have to change my shoes regularly. Every work shift, I have to wear different shoes to allow the sole of the shoe to recoil. Before bed and when I woke up in the morning, I need to do a hot roll foot compress. I put hot water in a bottle and closed it well. Then, I roll it under my foot for 10 to 15 minutes. Definitely, having a healthy feet means less stress and back pain. Better patient satisfaction and optimum nursing care for the public. Nurses will be more productive and can reduce sick calls. The outcome is happy nurses. The essential features of nursing shoes for optimal support means choosing your right footwear meticulously. A light pair of closed, anti-slip shoes with soft inner gel sole is recommended. Nurses working on the bedside needs to adhere in wearing shoes according to the hospital's guidelines. In addition, wearing soft, knee-length, and compression socks prevent foot ailments. A nurse's foot care routine, beyond basic hygiene. Maybe some of you are not aware that most nurses got a daily foot care ritual such as moisturizer application into the regime. Gentle and safe practices in maintaining skin tone and curbing potential skin issues. And lastly, the most important and critical care aspect of foot care is nail trimming and infection prevention. Advanced foot care strategies for long shifts. In addition to your foot care treats, a regular massage can alleviate foot stress and avoid chronic pain. The simple art and yet very effective leg elevation. This method of leg relaxation can enhance blood circulation. These foot care techniques can decrease foot pain and muscle swelling, and so easy to include into a nurse's busy schedule. You can visit a massage parlor, or you can simply buy a massage leg machine. So, what are you waiting for? Go ahead and enjoy your foot massage. I hope you enjoyed this foot care video. I highly appreciate your time and comments. Kindly leave a short comment. Every comment will help me to improve the content of my video. Thank you for watching and see you in my next video. Please click like and subscribe below.